I just
Great to
wanted
see
to
you.
introduce Sheila Buehler. She's with Footcare Professionals, and she's going to discuss some very important information as it pertains to your feet. So take it away, Sheila.
Oh, Laurie, it's so good to see you. And I love this platform for our seniors. I am absolutely passionate of helping people live well with their feet. I'm Sheila Buehler. I'm a nurse practitioner here in Rochester, Minnesota, and owner of Footcare Professionals. After a 30 plus year career at a local medical institution with background in transplant and cancer, I transitioned to procedure work in podiatry. And that's where I learned that literally, as we get older, all of us need help with our feet. I had no idea this was a thing
I
between our,
agree.
oh my goodness, between our backs and our hips and our knees and thick toenails and callus and our vision and hand dexterity. Literally, we all need dementia, Parkinson's, we all need help at some point. And shoes go from being a cute accessory to actual medical equipment. And so sometimes it helps to just have some guidance on where to start because it's really rare to ever get sat down and taught on how to help live well with your feet. So that's our mission, is to help care for people with their toenails and calluses. And we do swift microwave therapy for plantar warts, which goes after both the virus as well as the lesion, so that you can walk well. Because, of course, when your feet hurt, everything aches.
Hmm.
So, I appreciate this opportunity, Laurie, to help talk with folks a few minutes about what happens to our feet. So, basically, our feet, this is my little traveling foot. He's very well traveled, and you've seen him several times. Um, Literally 25% of the bones of our body are in our feet, and these bones are always shifting. They're held together with ligaments. We have extrinsic muscles, we have intrinsic muscles. We've got highways of nerves and blood vessels. These blood vessels, our heart pumps our blood and it goes down our aorta, down the middle of our body, and then it goes down our legs, and those blood vessels just get littler and littler and littler till they're just tiny little capillaries and arterioles at the tips of our toes. So often our toes are the canary in the coal mine. Sometimes you'll see circulation damage there first before you see it anywhere else. Neuropathy will start first at the tips of the toes and then work its way up if it's going to spread. And also our balance, believe it or not, as we get older, the number one source of falling is weak toes. So we want to keep our forefeet and our toes as strong as possible. And I'm not even talking about how the toenails, as we get older, starting in our mid 40s, actually, the toenails just get thicker and curlier. We get pressure points as the bones change, our skin thins, the pads on the bottoms of the feet thin. Sometimes, the ligament that holds our big toe straight, that ligament, he gets tired after a while. And so that toe starts to deviate. And then we get what we call a bunion bone. When that big toe starts leaning, now the little toes start sort of hammering up. And if there's a component of neuropathy, we'll often see all the toes kind of curl in. So you can imagine, with all this going on between that and the circulation, it's really hard to get down there and work on the toes. One of my most common questions is why are my toenails so thick and curly? And that has to do with all of these changes to the bones. When we're cute and 20 and our nails are on top of our toes, that's fine. But then as they start to curl or deviate to the side, now the toenails are more at an angle. And so when you walk, they're taking tangential pressure, and your body reacts to pressure by thickening it up. And so you'll get a thicker toenail. And if there's any trauma or even immune issues, then fungus from the environment can move in. So anytime you,
Sheila, I just
yes,
wondered, is there a way to cure neuropathy?
no, I'm so sorry. It's
Oh.
neuropathy is a whole another topic. Briefly, there's over 100 ways you can get neuropathy with your feet.
Oh.
And sometimes, if you can find the why, that's great. If you can rule out diabetes, rule out vitamin B12 deficiency, and even some of the medicines can induce vitamin B12 deficiency.
Oh,
So you want to make sure that if you're on an acid blocker, you're not vitamin B12 deficient. But beyond that, it's symptom control. So it's
mhm.
safety, it's making sure your shoes are wide enough, long enough, and tall enough to fit your bone structure. And then if you need a gait aid for balance, use that. And then it's there's medicines, Laurie, that can help with the symptoms. If the pain or tingling is keeping you up at night, then we'll use usually gabapentin or Lyrica or Cymbalta. There's
Okay.
also some studies on alpha lipoic acid, but again, there is no cure for neuropathy. It's work with what you got, make the most of what you got as long as you can. And one of the things I also counsel my patients, whether they have neuropathy or not, just from a fall prevention standpoint, is toe exercises. We want to keep those toes, whether they're numb or not, as absolutely strong as possible. So just doing toe presses, pressing that big toe into the ground, you can feel it all the way up the foot, and pressing those little toes into the ground. You can do that during the day, and that's going to really help just keep your toes as flat and strong. All those little baby muscles in there, keep using them. Do toe scrunches just like a cat. I had a patient the other day said, "This is like a cat." And I thought, I'm going to call these cat crunches. That's a great idea. So, yeah, it's just fantastic. The more you can use those feet and toes, just keep them stretched out because arthritis is so painful. And all we have is injections. Surgery is a last resort. So we recommend the best foot care you can afford. Shoes, we say shoes have two purposes. They have protection and then support. So if you have a flexible shoe, that's great. That's going to work and protect your skin, and it's going to allow your foot to be the spring that it naturally is. But if you start getting pain, you start getting plantar fasciitis, you start getting pain in your feet or your ankles or your knees or even your hips, then it's time to get a more supportive shoe. And that would be things like New Balance or Hoka, or I mean, they're good shoes. If you can, there's so much engineering into footwear. That's why they're so expensive. But if you can take a shoe and fold it in half or twist it, you're probably not getting good support when you need it. I'm not saying you can't go barefoot. Matter of fact, use your muscles while you got them. But when you start getting pain, go into support. And then you can think about an insert as well. What an insert does is it acts like a shock absorber. So that will make it so that when you strike your heel and you're walking over and over and over again, you've got a shock absorber so that it's easier on your bones and your heels and your ligaments and all of those systems we talked about. So those are just the basics on why your feet are changing. And you're welcome to, there's things you can buy over the counter to pad and protect and support your feet. Little gels. We use lamb's wool. We use foams. We use all kinds of separators. That's fine. But sometimes it's helpful to have professional guidance on what to use, where. The goal is to pad and protect the feet without adding bulk. You don't want to put a big bulky pad on the end of your toe or on the bottom of your foot and then add pressure and actually create an ulcer. So do what you can with your feet as long as you can safely get down there. But when the toenails get too thick or curly, just know that that's a good time to seek professional health care. And that would usually be with a podiatrist or a foot care nurse. I am part of the American Foot Care Nurses Association, and we have a network of us foot care nurses all over America, Canada, and even branching into South Africa at this point. So there's a consortium of us trying to help provide a need because, frankly, insurance does not cover routine foot care. It covers high risk foot care once there's been nerve or circulation damage. Hopefully, we can work with people before all of that happens so that we minimize risk of ulcers
Oh.
and amputation. And I'm going to just say one more thing, and this is my cheap and easy insurance policy. My one quick takeaway besides shoes is cream. Cream to the feet is
Oh.
actual medicine. So it's not cosmetic. Cream to the feet will, that dry skin, when things are dry and flaky, that skin is thin and it wants to crack. That is a portal for infection. Little
Mm.
bacteria can get in there and cause cellulitis, especially if there's an edema problem. You can get a shear force, which results in a pressure ulcer or a callus that, when it gets too thick or painful, cracks right into an ulcer. And if that ulcer can't get healed, if it gets infected, especially if there's a
Mm.
diabetic or circulation problem or nerve problem, that's where amputation comes from. So it
Oh.
all starts with dry skin and pressure points. So all it takes to cut that risk in half is literally just putting cream on the bottom of your feet at night. Your body doesn't care what brand you use. Just use something at bedtime. It's nice after a shower, but we don't want you slipping across the shower bathroom. So
No, we don't
we
want
prefer,
that.
no,
That's a whole different
that's a
problem.
whole problem. So that porcelain sink does not forgive. So anyway, so yeah, all your feet really need is good foot care when regularly, good shoes, wide enough, long enough, tall enough, and cream to the feet and support. Just know there's people here when you need it.
Sheila, I just have one last question for you.
Certainly.
Do you make house calls or do you go to retirement communities to treat these people?
Absolutely. I do have a clinic on the north side of Rochester, Minnesota, which is open access where anyone can receive care. But about 25% of my practice is in homes, assisted livings,
Mm.
and nursing homes. Sometimes there's some Medicare questions, and podiatrists can be hired to help out with some of that. But there's some scheduling limitations. So when there are breaks in care, that's exactly why Foot Care Professionals is set up, and they will love their appointment. We take care of the skin, we take care of the nails and the callus. It's a very lovely, very honorable way to provide dignity for your family member.
Well, that's great. I'm going to have to call you then.
It's a lovely, lovely thing. Yeah,
Well, thanks again.
my pleasure. Thank you for the opportunity, Laurie.
Oh, you are welcome.